Hi, this is Dr. Corey Maas on Looking Your Best. I had some great questions today that came out of the Appearance Care Center spa upstairs, and the nurses and I were going over it and discussing really a lot of the myths and sort of old wives' tales that exist around a lot of the treatments we do. And there's some great examples I can give you, like not bending over after Botox and some things that are frankly silly. But in the end, there's some key things that we can do. And specifically today we were talking about laser hair removal and IPL, or photorejuvenation, and the things that we should be aware of and we should be communicating with our patients and with you, what you should know if you're having laser hair removal, things to avoid before and things to avoid after, obviously, too, are very, very important. And there's not a lot of things about laser hair removal or IPL, some of these other energy-based light or laser technologies, that you really have to remember. The facts about laser hair removal, however, are pretty simple, and the processes that you should be keeping in mind. Laser hair removal, number one, doesn't treat the hair itself. The goal is to damage the hair follicle. The hair follicle is what creates the hair, so there's lots of ways to yank hair out, but they don't keep the hair from growing. The way that laser hair removal works is by targeting the melanin, which is the pigment in our skin and hair, heating the melanin up, and that heat destroys the follicle. So, if you have very light skin and very dark hair, you have the best chance for a great outcome because the skin is relatively clear, there's not a lot of pigment in it, and all of that energy is going to be absorbed by the hair itself, damaging the hair follicle. We think that's really the key thing. Now, that doesn't mean that darker skinned patients can't get laser hair removal. So if you're tan or if you're olive complected or even if you're African American, it simply means that we need to adjust the laser energy in such a way that we can treat the hair, which is almost invariably darker than the surrounding skin, whatever skin type you are, and that's really an important concept. So, I talked about that for one reason, and that is, if you're tan, avoid tanning. If you want to have the difference between the color of your hair and the color of your skin as much as you possibly can. Obviously, in some ways you can't control that, but no tanning before laser hair removal is really important. And that includes, by the way, spray tanning. So this doesn't have anything to do with natural or unnatural pigment. You want to be having you want your skin to have as great of a contrast between the hair that you're treating and the skin color as possible. Number two is, in preparation for hair removal, in our clinic we'll do this for the patient if they wish, but it's awful easy. It's much easier and even a little safer if you shave your own legs or bikini area. Obviously, it's very difficult to shave your own back. We'll do that for men and women if they have hair on their back, which is rare, or the face, which women often shave their faces. So a lot of people are concerned or asking, do I have to let the hair grow? And the answer is no. We only want the hair that is below the skin surface to be heated. In fact, having surface hair just absorbs more of the energy that's not effective or efficient in damaging the follicle itself. We obviously want you to be well hydrated and have a normal diet and all those sort of things. Be healthy and well rested anytime you come in for a treatment. So, and if you're not, we'll help you get hydrated, and that's really just so you feel comfortable during the treatment. So a summary on preparation for laser hair removal is very simple. You want to make sure that you come in shaved if you're able to do that in the areas and the shape that you want the hair shaved. That's important because the shape of hairs around the scutcheon or bikini area, some people are very particular about that. And it should be relatively freshly shaved without a lot of lumps or bumps or redness. We want the hair as short as possible, but we want it to exist. You should avoid coming in after waxing because the hair has been completely removed from the shaft, has been completely removed from the hair tunnel, if you will, the conduit through which the hair travels, and there's much less target. So you can't do it right after waxing. So and then number two is we want to make sure that the skin is as light as it can be. So don't come in after a spray tan or after 2 weeks in Hawaii where you've been tanning, because the difference between the hair color and the skin color has a big impact on how good the outcome is. Doesn't mean you can't be treated, but it requires more treatments when there's not as much difference between hair color and skin color. And the last thing, that brings up, which I think is important in preparation for hair removal, is people that have this very light kind of gray hair. It has no pigment at all in it. Represents very little target for all of the lasers that we use. And that's important. There's a few things that we can do. There's a type of a dye or stain that we can use that's applied daily and sort of washed off. It'll gradually get the hair to get some color to it. And that's a little cumbersome and problematic, but it does work. It's efficient. You can call us. We'll go through the process and get you the right product to use. And the other thing that I found is with light hair and even sort of peach fuzz hair, it seems a little more responsive to a treatment called intense pulse light, which is not very efficient for hair removal. I rarely, if ever, would recommend it for hair removal, except in those cases with sort of peach fuzz or light hair. So if you have any other questions about laser hair removal in general, the process, the preparation, or the recovery, please don't hesitate to write, drmaas.com. Send pictures or photos if you want, and I also welcome videos. And if you don't mind sharing it publicly, just let me know. If you want to keep it private, that's fine too. As always, it's a pleasure to help you keep looking your best. This is Dr. Corey Maas.